The public meeting?
Yep, I've clicked the button. This is now live on YouTube, and this is April 6th, 2020 at 4:30, and this is a city council work session with the mayor on the COVID-19 update. At the end of the meeting, we will have an executive session to discuss some items, and we'll need to take a vote to go into that. But at this point, we are at the public session, and Katie, let us know when it is shared on Facebook.
1 second. Okay, all set.
Okay, we are all set.
Thank you all for taking the time to meet with not only me, but the administration on the COVID-19 response. Today on the administration side, we have Gary Kirkmeyer, who is our Commissioner of Neighborhood and Business Development, Tim Curtin, who's our Corporation Counsel, Dr. Danielle Lyman-Torres, who's the Commissioner of the Department of Youth and Recreation, Alex Judelson, our Chief of Staff, as well as Chris Wagner, our Budget Director, and the Deputy Mayor will be coming in and out as he's finishing up another call. As you all know, I'll give a brief overview and then I'll answer any questions that you may have. I think that many people understand the crisis that we are currently in. Today, the governor announced that we will be in the current state at least until the end of April. There are some other discussions on the fact that we have not hit our peak yet. And because of that, we do believe that this is going to be longer than April. But they're taking it about 2 weeks at a time. Our numbers, the county exec has released the numbers earlier today. You can go to his website, www.monocounty.gov, to look up the specific numbers and be able to see the spreadsheet there. I don't have them in front of me, so I don't want to provide inaccurate information. But the COVID-19 virus is expanding in the city of Rochester. It's impacting, if you look at the spreadsheets, from what I understand, the 14609 and the 14608 area has the most number in the city. Those numbers are rising more than the other areas. We have, as a community, had a great response to the social distancing, but we need to do a better job of making sure that we're continuing that message to our community. And we've done several things in order to do that, from promoting different things on Facebook to also the county executive and I just did a PSA, and we will continue to go on the radio and other places to make sure that people understand that this particular virus is going to hit our community and hit it hard. And so I know that council has a number of questions that they have for the administration. So I will open up the floor, or if BJ, if you're providing those questions, then we will answer those questions that you may have.
Certainly, I provided the questions in advance to Josanne. The first one was the general update on the COVID-19 response. The second one is an update on ESG and CDBG money that the city is receiving, how we plan on using it, and if there's any way to address homelessness and housing.
Okay, so on the first one, what is the community response? As you all know, the County of Monroe is a lead agency when it comes down to the COVID-19 response. We are in constant contact with the county executive and his team on different methods. Today, of course, it was announced, I believe, on Saturday, and also he announced today about Dr. Mendoza announced today about the covering of the mouth when outside. It doesn't have to be a N95 mask. It could just be a bandana or some other scarf that someone puts over their face, but they're recommending that for everyone when they go outside. He also, Dr. Mendoza talked about what our numbers are, our capacity. Right now, we have not reached our capacity with ventilators or other things in our community yet. But if this continues to go up, then we will reach a point where we will need more ventilators, and they will be relying on the state to provide that. We have the proper PPE that has been given to our employees. We don't need any at this point in time. But depending on how long this lasts, that could become a problem. But at this point in time, we have all of the PPE that we need. We have received hand sanitizer from the governor and through the county of Monroe. Our fire department is working with the emergency response team. Deputy Chief Felipe Hernandez is the person that's the contact person in the fire department for all PPE as well as resources that the city may need through the county of Monroe. We also have been in constant contact. The governor's team has a meeting every day. I know that some people participate on that call and are on that call and can ask questions as well. And so on every level of government, the city of Rochester is there. If you want to talk about the specific numbers, I believe the deputy mayor was on a call with the deputy county executive earlier today and may have some updates around specific numbers. But as far as I know, we've had 30 deaths. We have about 28 people that are on the ventilators right now. We have about 530 people that have been diagnosed positive, about 4,900 people have been tested in our community. One of the things that we have requested is that that data be broken down into demographical data and across the board. And they are looking at a way to do that because currently the system does not provide a way for that data to be extrapolated. But we are pushing, and I know that Councilmember Patterson was on a call earlier today and asked that question as well. I don't know if the deputy mayor wants to add anything else as to what the response to COVID is, but I would just want to make sure that people understand that one of the things is that the city is not the lead agency, so you would not see us leading the discussion on this because the Department of Health reports directly to the county executive. And but they have been very, very receptive and have kept us in the loop every step of the way, and we appreciate them for their leadership on this topic. Deputy Mayor, do you have anything to add to that?
I would just add on the county call, Mayor, I know that Chuck Schumer, the Senator Schumer, was on the call, and the mayor was able to ask him a question and actually pushed for aid for cities in the next wave of federal relief to make sure that we could overcome some of our revenue shortfalls. And so I think the senator responded positively, Mayor, and to your question and to your request. The state also announced today that they have that they're trying to get arms around the issue of mental health and the fact that we have a lot of people who are home who have mental health needs that aren't being addressed. There's a website called headspace.com that's there to give people some outlet to help them meet their mental health needs. Also, got off a call when I jumped on here. They are looking at housing data right now as part of the initiatives with the county and the United Way to see how we can meet needs as it relates to that. They also got into some predictions and some modeling as to where we are with peak and surge here in Monroe County and Rochester. And even under the best case scenarios, we still are short as it relates to hospital beds, ICU beds, and ventilators. And so that's the big push right now. The hospital systems have found 106% bed capacity, which is good news.
Well, the other thing is that hasn't necessarily been publicly announced. And so this is live right now. So we want to make sure that we recognize that.
The bed capacity, it has been announced, and that has been a good thing, but we still have some ways to go.
Mayor, I'd like to know more specifically about an update on our activities as an employer with regard to responding to COVID-19. I think we've taken some steps that people might want to know about.
Okay, so as it pertains to our response as an employer, every week we have a meeting with our local unions, giving them information. We've provided and we've cut our workforce in half from essential employees to non-essential employees. The non-essential employees, many of them are, all of them are working from home. We have some people that are rotating in and out of the building. all of our buildings. We have not stopped our services in the police department, fire department, or DES or DRISE. DRISE is focused on, of course, distributing food to the community, and so many of them have been reassigned, and I can let the commissioner talk about that. DES Commissioner Norm Jones is not here and not on the call today because he had another meeting, but all of our services are up and running. One of the things that we did stop, and I know that's one of the questions, and that is the bulk pickup. That was one of the concerns that the local union had raised around handling the bulk pickup. Many of the bags and other things that people outside cleaning up, breaking leaves and other things into different packages. They were concerned about the safety and the health of their members, and of course we are as well. So one of the ways that we thought that we can mitigate that is to make sure that we collect the garbage that's in the green can. It doesn't mean that we won't, that if someone doesn't comply with the bulk pickup and put something out, we would go and pick it up. We would provide them with the warning. But our goal here is to make sure that our employees are as safe and as healthy as possible, and we don't want to expose them to any unnecessary exposure to any environmental hazards that they don't have to at this point in time. Because all of our trucks are automated, meaning that we are way ahead of the curve when it comes down to one person being in the truck, automated systems. Other cities do not have that. So our refuge people are able to go out and maintain and pick up trash the way that by bringing the toters. We have, like, I believe, one route that you have to bring the toter to the machine. When it comes down to City Hall in and of itself, our MBD team is still working, our law department is still working. People are rotating in and out in shifts. We are an essential employee overall. Government is an essential employee. So employers, so our staff people are coming in and we are maintaining our social distancing when doing that. We have people signing in and out of the building. We have provided everyone that is on our cleaning staff with the proper PPE in order to be able to clean offices and turn over offices when that's needed, and we're doing that extensively. When it comes down to our police and our fire department, we have, of course, given them all the proper PPE. And we also have on back order thermometers that hopefully will be coming in soon. We've been waiting on those thermometers for a couple weeks now. They're on back order, the proper thermometers, so that when people are sick, feel sick or something like that, and if we want to move to testing people's temperature when they walk in the building, we could do that with the proper equipment. But we also know that given the fact that this particular virus strain, you can be asymptomatic, you don't have to have a fever and actually have it. That may not be the best way to make sure that people are, employees, just by taking their temperature. So that is the reason why we've exercised social distancing. That's the reason why we do thorough cleaning of all of our facilities. And we have provided the proper PPE for every union and also for the employees that would like that. We have hand sanitizers that are distributed and available all throughout all of our buildings, and we will continue to do that. We have only had, I believe, 2 employees that have tested positive. And we do have some that are at home because they have family members that may have needed to stay home, or they're self-quarantining. We have some people that have some health challenges that either are recovering from having surgery, or from that are on chemo and other things. And so we're respecting people that also have health challenges, and so we're making every effort to protect our employees during this time and make sure that they have the proper equipment that they need in order to be safe and also provide the essential service to the citizens of Rochester. Did that answer your question, Madam President?
It does, except for the prospect of testing for the first responders.
So currently, again, this is something that if a first responder is exposed to a person that has COVID, then they would be tested like nurses or doctors. Right now, there are not. It's not automatic, and that's not a decision that the city makes. It's a decision that comes from the county health director. I know that that is something that people are talking about, but I don't have an answer for you right now, because there are not enough tests in our community to test all of first responders every day. If
Okay,
if they're exposed or if they have symptoms and they feel sick, then they could get a test. They would be first in line to get a test, but it's not something that's automatic.
Hello, Madam Mayor. Mike Patterson. So I asked roughly this question a month or so ago at our last council meeting. And I understand what you said and I understand why you said it. And I get all of that. But given our current federal leadership, I think we have an obligation, us small folks in city government, to formulate a plan and to push a plan and to strenuously advocate for the testing resources we need for our first responders. I understand what you're saying. I understand why you're saying it. I understand how that works. I get that. I know we don't have enough testing materials to test all of our first responders every day. But I think we should still be working on developing a plan to do that. And as those opportunities present themselves, to advocate to a Senator Schumer, to a Representative Morelli, to a Senator Gillibrand, that we push to them the fact that our forward-facing people need to be safe, in addition to the folks who are working in hospitals. And the only way we get out of the current situation that we're in is that we're going to have to, my thought is we have to test our way out. And that's not just for the city of Rochester, that's for the entire nation. But I think that conversation has to start. And if it doesn't start anywhere, it needs to start in Rochester. So
this conversation is already happening across the board. I know that the governor has been addressing this. He has been pushing for this, more testing in New York State, more testing in Monroe County, more testing in Rochester, something that we're pushing as well, wanting more testing for our entire community and our first responders, of course. They're developing and they're right now trying to develop a rapid test, because one of the other issues is the fact that when you're tested, it has to go to a lab. So you don't get those test results for a couple of days, depending on how far backed up the lab is. That's why you see these surges. So depending on how backed up the lab is, then that's when we get the results. So this is a complicated system that we are not locally in control of, but we will continue to advocate for those resources and for those testing opportunities to come to not only our first responders, but for everyone, because I think that you're right on the fact that the only way that other communities, especially other countries, have been able to come out of this has been through rapid testing and testing a lot of people, and everyone that needs to be tested being tested. We're not there yet as a country, and that's something that I know that states across the board is pushing the president towards, and we will continue to advocate, but we can't make up our own test. So we will continue to do what we can to advocate for it, but at the end of the day, we are have to be responding to what the CDC says, what the state health department and the county health department guidelines are for testing at this point in time.
Well, Madam Mayor, I understand that, and I agree with all of that. But my thought is, if we develop a plan for testing and we push the plan, that's the stick that we use to beat the federal government to get where we want them to go. And that's why I'm asking, what is the plan? I understand we don't have.
I don't. What do you mean by what is the plan? I'm trying to figure. When you say develop a plan, what do you mean?
A plan for testing our first responders, specifically our police and our fire? If tests were available, how often would we test?
That would be based upon the county's health director. That is not a call that we make locally. That's why I started this off by saying that the city is underneath the county of Monroe, and as it pertains to testing, when people are tested, how they're tested, all of that is directly related to when the county health commissioner, Dr. Mendoza, and also the CDC and also the state guidelines. And so they're also at the, there's layers of government that's a part of this. And so they have to report up to the state. Many of the tests are not released locally. It is a state system that releases the test. And then they also are in constant, contact with the CDC and the federal government. So I understand your concern, council member. I definitely do. I just don't want to put out there that there is something that we can do locally to push the county or the state or the federal government to do something that they're not in a position to do at this time. They don't have enough tests. They're currently in the process of trying to develop a plan, and a plan that would allow for rapid testing. So like when you go to the doctor for a flu test and you think you have the flu and they give you a swab and you get a rapid right there on the spot, you get a results. That's going to be the most effective way. And they're in a process of developing that right now. And once that's developed, that will be the way where everybody can get tested rapidly and basically every day when there's enough tests available. And we will, I assure you that we will continue to advocate for it though.
Okay. Well,
All right.
I'll reach back out to you later. Fair
Okay. All right.
Does that cover the questions we had in our general session?
It does not. There are still
No.
two outstanding ones.
So the second question around the CDBG and ESG dollars, our understanding is that those dollars are not directed by the city alone. And I know that the commissioner will talk about this. We have to develop a community plan. And that is in conjunction with community organizations. And we have put together a table to actually talk about the ESG dollars as well as the CDBG dollars. And the commissioner will talk about that right now because it's not controlled by the city. However, let me also say this. We were on a call earlier today where it was released that the city was actually going to close homeless shelters and put people into hotels. And it was said matter of factly that that was going to happen. And it said, and when we asked who, where did this come from? It was stated that this is something that Councilmember Lupien was advocating for. And my concern here is that we all need to have a unified understanding of exactly what we're going to do as a city to respond to certain things and what we can utilize these dollars for. And we need a clear understanding of that before we go out into the community and make any suggestions. And so we need a clear path of who on council is going to be speaking for council. And my understanding is that that has in the past always been a city council president. And so for us to get blindsided by other people in the community that the city is going to do something that we are not prepared to do, I think is wrong, and it causes confusion in the community. And so one of the things is to properly understand what the CDBG dollars and ESG dollars could be utilized for. That's the first thing that we needed to understand. Today, we finally got the letter actually stating that this is the amount that we were going to get, as well as the guidelines by which we needed to operate. And therefore, that's what we are going to do. But I want us all to be very conscious. Everybody's an elected official. Almost everybody is elected official on this call. And I'm not saying that elected officials cannot speak. What I'm saying is that when it comes down to creating a plan or releasing what the city is going to do or not do, that needs to come from either the council president or through the council president's voice or from the administration, because it causes a lot of confusion when other governmental entities get a hold of that and they operate on that, and it's not possible. And so some suggestions are great, but they're not realistic and they're not possible. And so now I'm going to turn it over to Commissioner
I'd
Kirkmeyer to
like
talk.
Could I just respond really quickly? That is not what I said at all. I've been working on behalf of some of the shelter providers who've been reaching out to me to decrease the bed count in shelters, but never did I ever say that this is something City Council was going to do or tie it to the money. We had been talking about ESG dollars and what they could be used for in one of the calls, but this is really something that FEMA money would cover. So I'm not sure where the confusion happened, but I definitely, and I've been in contact with our president to let her know kind of where I was advocating. But I'm sorry if anyone got the wrong impression and that it caused confusion.
Well, thank you for that, and that's why I'm bringing this up on this call and on this session, because I think that that's part of the concern, is that the advocacy is great, and we definitely want people to be advocating for different causes, but when it comes from a council member about a certain issue, then it gets confusing because people take that as the city is going to do X, Y, or Z, and we're not prepared to move that way. That discussion was matter of fact. It was that the way that it came in that call was that the city was going to shut down the shelters and put people in hotels. That was what the message was. The message was then delivered to them that we had no idea about that conversation or about what was happening as it pertains to the advocacy, but that we had just gotten information on ESG dollars and how we could actually utilize those dollars. And that's what we were going to have this conversation about today. So I'm just saying, everybody just be cautious about direction and other things that we are saying, because when you say it, it becomes gospel, and it may not be actually the truth or the path that we're going to go down. Commissioner, I'm sorry, President Scott.
Yeah, I'm sure that we're going to be more careful in making statements that could be misinterpreted, recognizing that people often hear what they want to hear and bring away from a conversation what they would like to have heard. What we will make sure of is that our members, that my colleagues, know the limitations of our respective roles and where our authority and responsibilities lie. And that's one of the items we're going to talk about as well, because I think sometimes the lines get blurred. And we're going to work to make sure that we can clarify the lines.
Thank you, Madam President. Commissioner Kirkmeyer, if you want to talk about the CDBG as well as the ESG dollars and what we found out as to be the guidelines for utilizing those dollars, that'd be great.
Sure, thanks, Mayor. So as the mayor said, we finally officially got our award notices for both CDBG and for ESG and HOPWA. We also received guidelines on waiver opportunities for ESG. We have not yet received those guidelines for CDBG, so we're in better shape with ESG. Our housing team met actually this afternoon at 3 o'clock. I was hoping to get an update from them for this meeting, but they're probably continuing to meet with our community partners and care, because as the mayor said, that plan has to be a community plan that's submitted for approval. So one of the things obviously that's of most interest to us from ESG perspective is this eviction prevention in the form of rent subsidy, and trying to make sure that, you know, the financial constraints of our residents and our landlords are both met at some point here, hopefully. CDBG, we're in the earlier stages, again, because we don't have that information, that guideline to guide us through what waivers you can apply for. We're hoping to get that today or tomorrow. We already have meetings set up for Wednesday in anticipation of that. One of the things that we're hoping, and this is just one of the things we're hoping to do with CDBG, is continue our small business grant effort. Our small business grant, the new grant that we've been giving out, which averages about $2,000 for everyday cost of businesses, have been flying out the door. We had over 100 last week, and it's putting a real stress on staff, but we're getting through it. Point being is we're going to run out of funds if we can't use CDBG. So we're going to try to see, especially with hopefully the waiver opportunities, that we can make CDBG fit into that really fast-paced grant process. And there'll be a whole bunch of other things that we engage the community about in formulating the CDBG plan. But for right now, that's about all we know. We'll know more this afternoon as soon as I touch base with Carol Wheeler. She went to the meeting this afternoon. Hopefully we can construct a community plan rather quickly and get access to this money and get it out.
One of the big things that we have been receiving emails about is from, two different segments and groups in our community, advocacy groups in our community. And our hope is that through this community plan that we will be able to come up with a plan to not only help tenants, but also to help make landlords whole in this process and give tenants the relief that they need. And so that's one of the things that I know that our Director of Housing, Carol Wheeler, is talking with the ESG team on right now, is that the county has dollars as it pertains to the homelessness issue, and has been the Deputy County Executive, Corinda Costell, has been leading the effort on those relief dollars for homeless shelters. And the Deputy Mayor has been participating in calls with the wraparound services group every morning to talk about support for homelessness and our homeless people in our homeless communities. And so the county is taking the lead on that issue. We are really looking at ESG dollars to be utilized to help tenants be able to weather the storm during this process, as well as help landlords. This model had been used before after I believe it was after the housing crisis break, and it was a relief stimulus package that was provided during that time. And so we're going to be looking at that, but we'll be waiting for Commissioner Kirkmeyer to give us a update once they come back with the plan for CDBG, for ESG dollars. And as soon as we know the guidelines for CDBG, we will also let council know.
Thanks for the update. I also wanted to mention that there's a bill at the state level. It's 8140 that advocates are pushing for, but it's not cancel rent. It would also make the landlords whole. It would reduce rent down to 30% of a person's income, and then give a voucher for the landlord for the missing portion. And I don't know if that's something that the city or council wants to advocate for. That would help us out.
Does it have a Senate sponsor? Is that the Senate bill, or is that a different Assembly bill?
Senate bill.
Okay. Does it have
It's
a
in the
Senate sponsor?
Kavanaugh.
It has an Assembly. So it's a
it's
double
Assembly's-
bill, or is it
I think it's a bill, but I'm not 100%.
okay.
I can get you that information.
Okay. The reason why I asked, does it have a Assembly and a Senate sponsor, and does it have a dual number, or is because both of them would have to pass both houses and then go to the governor in order to become law. And so I'm wondering where the other legislators are in the other house. That is because I don't believe that Senate bill that was introduced that people were advocating for last week has a Assembly sponsor yet. And so we will
About
want
the
to
cancel
make
rent?
sure that they have sponsors, and that they're on the and what the state is willing to do as it pertains to that, since they already passed the state budget.
Yeah, it does seem that out of all of the rent bills, this is the one that has the most support, but I'll get you the information.
Okay, great.
Okay.
BJ, there was another question on bulk refuge. I thought I answered that already, but
You did.
I'll run through that again. And then I know the Deputy Mayor has some additional information. So as I said, our local union, of course, wants to, and of course, we want to limit exposure. They raised the issue about the handling of bulk refuge and having to sometimes get out of the truck and actually sweep up and pick up certain things as it pertains to bulk refuge. We thought that one way to mitigate those issues was to make sure that we encouraged all of our citizens to put all of their garbage in the green garbage bin that's been provided. We pick that up every week. And then we would, once the virus subsided, we would then open up bulk refuge. But we do still have on-demand bulk refuge pickup that is still available that people can call. And if we see it out there, we will of course pick it up, and then we would call, we would provide them with a warning, letting them know that during this time, we are trying to limit our employees' exposure. And so we want to encourage all of our citizens to put all of their refuge inside the green bin, and that's when we will pick it up. And I'm not sure, Deputy Mayor, do you have anything to add to that?
Sure, I'd just add one point. Obviously, the mayor's talking about efforts to preserve our workforce. Another reason why we are suspending bulk refuse is from a continuity of operations perspective. If we stop with the collection of bulk refuse, and as we are approaching the apex of this outbreak in our community, if our refuse collectors were hit by that, we would be able to continue operation and picking up waste out of the toters and not the bulk waste, even with a largely reduced workforce. And so that's part of the continuity of operations plan. And so in the collection of bulk refuse, even if it were for just 1 week a month, is part of our strategy to be able to continue providing the service over the long haul.
Could I ask a question about that? If folks didn't get the memo and put their bulk stuff out to the curb, will they get ticketed for that?
No, they will not get ticketed. Right now, they will not get ticketed. We will provide a warning first. And that's, we are trying not to be punitive. This is truly about keeping our employees safe, as well as being able to preserve our workforce. And so this is not to be punitive to our residents. It's just to make sure that we're doing everything as a city to provide for opportunities for our residents, for our employees to stay healthy.
So I think that covers those questions.
That was all of the questions that were submitted in advance, yes.
Can I just ask one last thing? So just for clarity, so the biggest, obviously the $4.8 million with the CDB, with the ESG is the biggest way the city is going to find some way to offer some type of relief somehow, some way, and the administration is going to take the lead on developing a plan under Commissioner Kirkmeyer's lead, and will keep us posted as a council as to the timing of that and what's involved. I assume that's correct. Is there any opportunity for other forms of relief, specifically financial relief for people who we know have been hit hard during this pandemic that the city is considering, or is it all going to be wrapped up into the ESG plan?
As it pertains to rent relief?
Rent relief, tax relief, anything that's going to hit people's wallet. Is it all going to be part of the $4.8 million ESG, or is there any other conversations being had around that as well?
So there's conversations that's being had every day about relief. So the CARES package was from the federal government, was the stimulus package that just passed was for where we got the ESG and the CDBG dollars, and that was to provide some, relief to our residents. That's not necessarily provide relief to the city. We still have to provide the essential services. So when we talk about the ESG and the community plan, Carol Wheeler is working with the continuum of care in that table that's already been set to develop that plan, and we'll provide that to the commissioner, and then we will, of course, bring that to council, because in order to spend any of these dollars, council will have to approve of that plan. But in order for us to get an approval of the plan, for us to even submit it to council, and after council, so before we can even spend $1, we need to get approval from the federal government that our plan is accepted. So there's separate steps in this. So that's the first thing, that it's not just we decide we want to spend it on X or Y and we can do so. We have different layers of government that we have to go through in order to actually expend those funds, and council will have to approve the distribution of those funds. So we also, as Councilmember Patterson indicated earlier, was on a phone call with Senator Schumer that County Executive Bello held. And I had an opportunity to talk to him about revenue streams and the loss of revenue streams for the city of Rochester and cities across the country. It's something that's being talked about. This is not like a tornado or a flood that went through a community and you can see the devastation. And so, you know, you have to build houses. This is something that you can't necessarily see, but you feel the financial impact of what's happening. And so it's a health crisis that turned into a financial crisis for our city, as our budget director often tells me. So we are advocating at a state level and a federal level for relief as it pertains to loss of revenue. There are also discussions that are happening on how do we revitalize businesses that have been shut down during this crisis and provide them with relief. That's on every level. So it's not just what the city is providing, but the county is providing relief. We have the state is providing relief and the federal government is providing relief. Every day, the deputy mayor and I are invited to a call with the United Way, who is also providing relief and funding to different organizations through the community foundation, that they have relief funds that way. And so there's many different tables that are being set to talk about the financial crisis that we're in and what type of relief needs to be provided to different segments of the community. And so there's a homeless table, there is of course the business table, there's landlords tables, there is a tenants table. And so those conversations are happening across the board. What type of funding will be made available for each of those particular segments, I cannot tell you at this point in time. I can tell you that, but there has been relief for some of those particular sectors of the community. We will keep you up to date as to what we find in different packages that may be relieved revealed from the state level, as well as from the federal government as they become available. But I do know that this discussion is taking place across the board for every sector.
Okay, thank you, Mayor. So I would like to entertain a motion to go into executive session to
So
discuss
move,
the
Madam
real
Mayor.
estate matter.
So move, Madam President.
Is there a
Second.
second?
Second.
All in favor?
Aye.
Aye.
Say aye.
Just for the record, who was the second? I have Council Vice President as the first.
I'll
Madam
take
President.
second.
Okay, Mike Patterson. And that was, so allow me 1 moment to stop this from streaming.